In this video, you will learn about the symptoms of the previously talked mental disorders. These will be anxiety disorder, depression, bipolar disorder, post-traumatic stress disorder or PTSD, schizophrenia, eating disorder, disruptive behavior and dissocial disorder, and neurodevelopment disorder. The symptoms for anxiety disorder are increased heart rate, which is a racing or pounding heart, sweating, which is excessive sweating or especially palms, trembling or shaking, which is muscle tremors, shortness of breath, which is difficulty breathing or hyperventilation, nausea or stomach upset, which is gastrointestinal distress, fatigue, feeling tired and drained, muscle tension, tightness or aches in the muscle, and sleep disturbances, difficulty failing to sleep and staying asleep or feeling restless. The symptoms for all these mental disorders can sometimes not apply to the person or persons. The symptoms for depression are a persistent sadness, which is a prolonged feeling of sadness, emptiness, or hopelessness. Loss of interest, which is a loss of interest or pleasure in activities once enjoyed. Irritability and anger, which is increased feelings of anger, frustration over minor matters. Feelings of worthlessness and guilt. Great feelings of guilt, self-blame, or low self-esteem. And hopelessness, a bleak outlook on the future and a belief that things will never improve. The same for anxiety disorder and all other disorders. There are some symptoms that cannot be present in a person diagnosed with the disorder. The symptoms of bipolar disorder are high energy and activity, feeling restless, needing less sleep, and engaging in excessive activities. Rapid thoughts and speech, racing thoughts, rapid speech, and difficulty concentrating. Inflated self-esteem and grandiosity, feeling overly confident, important, or talented. Impulsivity and risk-taking, making poor decisions, spending sprees, or engaging in risky behaviors. Irritability or aggression, feeling easily frustrated, angry, or combative. Distractibility, difficulty focusing on tasks or maintaining attention. Hallucinations and delusions, experiencing false perceptions or beliefs. Maniac and depressive episodes, episodes where the person either feels energetic or helpless. The symptoms for PTSD are flashbacks, feeling like you are reliving the traumatic event, often triggered by sights, sounds, or smells. Intrusive memories, unwanted and distressing thoughts or images relating to the trauma, avoiding reminders, trying to avoid situations, places, people, or thoughts that remind you of the trauma. Negative thoughts and beliefs, having negative thoughts about oneself, the world, or the future, and feeling blame or guilt. Feeling on edge or tense, feeling constantly alert and vigilant, with difficulty relaxing. Ongoing negative emotions, experiencing persistent feelings of fear, anger, guilt, or shame. The symptoms for eating disorder are spending a lot of time worrying about your weight and body shape, avoiding socializing when you think food will be involved, eating very little food, making yourself sick or taking laxatives after you eat, exercising too much, and having very strict habits or routines around food. Symptoms for disruptive behavior and dissocial disorders are frequent anger and irritability. The Recovery Village notes that individuals with ODD often experience frequent outbursts or anger, temperature tantrums, and easily becoming annoyed. Aggression towards others. Individuals with CD may display aggressive behaviors, including bullying, making threats, or physical aggression. Substance abuse. Better Health Channel mentions that some may have a tendency to use drugs and alcohol at a young age. And finally, the symptoms for neurodevelopment disorder are development delays. This includes delays in walking, talking, and other motor skills, cognitive difficulties, challenges with memory, attention, learning, and problem solving, language and communication problems, difficulty with speech, understanding language, and using appropriate language in social situations. Tic disorders, involuntary repetitive movements or sounds, such as in Tourette syndrome. Treatments for mental disorders are still being tested and experimented on for people out there who have the same disorder. As of right now, people have been treating mental disorders by medication, psychotherapy, support groups, and alternative therapies. That is all for this video. Thank you.